Good afternoon, everyone. Welcome. Today is Wednesday, April 3rd, 2024. This is an afternoon work session, and our topic for today is to look at behavioral health services and some of the discussions that have been taking place regarding prioritization of our impact fund grant dollars that will be available to the public later in the year. My name is John Kafalis, Larimer County Commissioner, District 1 Chair, joined by my esteemed Commissioner colleagues, Kristen Stevens, District 2, Jody Shattuck McNally, District 3, got to catch my breath, I ran here. And Assistant County Manager, Lorenda Volker. Jeez. Let's start all over. Justine, can we play the tape back? No. Forgive me. I need to transition, but I didn't have the time. Lori Kadrich, our Assistant County Manager, and we have other good folks across the table. Lori, would you like to make some opening comments to kind of cue this up a little bit?
Thank you, Commissioners. This is our annual report to the Commissioners that sets the stage for what kind of impact grants will be awarded and what the parameters are for this cycle. And so I'll defer to Laura Walker to kick it off.
Wonderful. Thank you, Commissioners. As Lori Kadrich mentioned, I am Laura Walker. I serve as the Human and Economic Health Director for the county and also have been for several months serving as the interim director for the Behavioral Health Services Department. And so, as mentioned, this is an annual event where we bring the input from our advisory councils forward to the commissioners for consideration of final approval of or staff direction to give approval for moving forward with the priorities as they're going to be outlined. So I'm going to hand things over to Jessica Plummer, our esteemed program manager for this grant program, who's successfully been delivering these dollars to our community for several years. Thanks.
Thank you. Pleasure to be here. I'm Jessica Plummer. I'm the program manager for the Behavioral Health Services Department, and I oversee our Impact Fund grant program. As a reminder, our grant program goes through, as Laura mentioned, an annual cycle every year, and we meet with, in the springtime, our advisory groups. We have 3 different advisory groups. One is our Behavioral Health Policy Council, and those are made up of elected officials across Larimer County. And we also meet with our Technical Advisory Committee, which is made up of professionals in the field of behavioral health. And we also meet with our Consumer Advisory Committee, which is made up of individuals with lived experience who have navigated the behavioral health system. And so we meet with them 3 times in the spring, what we call a work session, to get their input on where those behavioral health dollars should be prioritized in the community. And so this is a timeline of the things that we worked on, the roadmap for our 3 advisory groups. And so we met with our Technical Advisory Committee and our Consumer Advisory Committee in January to talk about what's being done in the community. And so we took a look at our Community Master Plan 2.0. And so I think you guys have seen that. It's been presented across the county. One of the initiatives for that related to the Impact Fund grant program was to look at multi-year funding. And so that is something that the grant program is looking forward to do and implement next year. And part of that, a work session in January also looked at reviewing the history, data, and trends of the grant program to see where money has been going the past couple years, to provide context of where they think funds need to be prioritized in the future. Once they had that information, we met again in February to discuss how do we use that data to inform our grant program priorities. And so in addition to that, we also took a look at our 2021 outcomes report. So those are grants that were awarded in 2021, but actually took place mostly in 2022, and we got some of those final reports in the beginning of 2023. So we looked at that report that was produced last year. They hadn't had a chance to see it yet, so we took a look at that. We're also in the process right now of looking at 2022 outcomes reports separately because those have just closed out as well, and so we have some key trends and information from there. And so we met with those groups and talked about our targeted projects. The targeted projects were something that were developed 3 years ago through these advisory groups. And you'll see that on the next slide. There's about 5 or 6 different targeted areas of focus. And talked about any recommended changes they have for this year moving forward. And then in March, we met to talk about what long-term strategies should we pursue. And so that was looking at the future of taking a look at what that multi-year funding initiative could look like, what data we want to track, what things do we want to focus on. And so I'm opening that up to conversation for what we need to look at moving forward. So that was all presented to our Behavioral Health Policy Council on Monday. So they reviewed and recommended those recommendations to bring forward to you today in this work session. So those recommendations, every year I've come here, there's usually been some kind of big change to the grant program, something new or big is happening this year. Things are pretty steady. The feedback from the advisory groups was consistent in saying that they want to keep those targeted projects the same. Not a lot has changed. Those are still the key gaps in the community that we want to fill. We want to target those impact fund dollars for. And again, that's a $2.8 million pot of funding we have allocated towards those grants. One of the other things that came out of some of those discussions was being able to assess secondary and tertiary impact areas. So not only being able to understand the primary area of focus based on those target areas, but take a deeper assessment of some of those grants and identify, because there's a lot of overlap in organizations and the services they're providing and the populations that they're providing, and to take a deeper dive to understand the true impact of those dollars. And so that is something that was a recommendation that we can, as a department, take a look into evaluating over the next year and help inform some of those multi-year funding efforts moving forward. The other thing that came out of some of those conversations was setting a goal to target prioritize funding for those targeted project areas. And so they suggested a goal of 70% or more, which is something that we've actually been doing anyway in terms of making award decisions. But it hasn't been explicitly said we are going to definitely do this, and hadn't had a target in place. And so this was just calling out, being more specific to say, yes, a majority of the funds we want to go towards this. I'd say the sweet spot was somewhere between 70 and 85%, because we also have, in addition to those targeted project areas, we have a responsive category. And that's important to have in there as well, to be responsive to the needs in the community. New things that are coming up that may not fit into those buckets, but are also very, very important in addressing in the community. So what that looks like when you're talking about a $2.8 million pot of funding, 70% means about $2 million of those dollars will be going to those targeted areas. And those targeted areas are listed on the left. So that includes youth services, care coordination, services in diverse settings, meaning a lot of peer support or non-clinical services, alternatives and interventions in criminal justice, where we have our Gary A. Darling Award, workforce expansion and support, and some system integration. So really trying to balance that portfolio to make sure that we are being deliberate and making sure that funding is going to those targeted areas, as well as leaving some money available for emerging needs. Yes.
Yes, thank you, Jessica. Can you give us a couple of examples of projects or in the responsive category?
Yep. So there's a couple I can think of programs that do a lot of education to the public that could cross a lot of different areas, including veterans or youth, and they kind of do all the buckets, so they don't necessarily fit under just the youth category or care coordination, but they're doing training events would be one of them. Some of the Fort Collins Museum of Discovery, doing events there, community events, there would be a good example of that.
Thank you. Please continue.
So those are the recommendations for 2024. I just want to update you on some of the other conversations that we had about where we want to go moving forward, or what the advisory groups had talked about in some of these conversations. in terms of the long-term multi-year funding strategies they'd like to see. What really resonated and percolated up was this idea of collaboration over competition. We are seeing an increase in organizations applying and competing for the same dollars, and we know that there's a lot of overlap between organizations, who they're serving, and trying to facilitate some of that or incentivize some of that system integration by having organizations work together. If there's a financial incentive for some sort of collaboration and being able to track that longer term, you can do that more easily in a multi-year funding effort because relationships and MOUs and things like that between organizations are hard to achieve in 1 year, which is what the grant program is currently serving. It's serving 1-year grants. And so if we're moving towards a multi-year funding strategy, that is something that rose to the top of something that they would like to see. And that is actually a key trend that we're seeing as we're pulling information out for those 2022 outcomes reports, is that collaboration is really helping to get services to people and supports, those wraparound supports that are needed in their behavioral health journey. Another item that was suggested is support program evaluation, which is something that we fund and support anyway if an organization requests it and has capacity to take that on. But if we're going to be investing in some longer-term funding initiatives, that would be really great to be able to partner better in doing program evaluation, to making sure that there are baseline measures and that we're tracking that over a longer period of time. So over the course of 3, 4, 5 years, we can report back to the community kind of what those things are. So there was some conversation about health equity, and that's kind of what that third bullet is about, making sure that we are addressing some of the vulnerable communities. And then some of the conversation was about improving that data and reporting for longer-term investments. That's it. Did we have any questions?
Yes, thank you. Thank you very much. Well done. Commissioner Shattuck McNally, please.
Thank you, Jessica, and as being the liaison to this board. This is not new for me. We've been talking about this for months. But I want to go back to the support program evaluation and maybe expand on that a little bit more, and trying to understand exactly, because we've had a lot of conversations about this, but so a couple of questions. Are we looking at how we, in the long term, evaluate that? Or are we helping others evaluate kind of the long-term programming of their events? What do you see this as is your ideal kind of way to go forward? Because I know we're also looking at this with other, like the RUAC and other things. That'd be great to kind of make sure we're not working in silos, but trying to talk the same language, if that makes sense.
Sure. Currently, how it works now is it's organization-driven, so they're evaluating their programs based on what makes sense for their program. And so I think if we're going to take invest longer term, and we can be a more active participant in those conversations.
Okay. And what do you see as us as a county as you're evaluating these? Because they're pretty different, but there are some baseline measures we can ask for, that we could ask for to be a part of all those programming. So what would you like to see? I know what I'd like to see, but I'm curious what you would like to see.
There are a lot of metrics out there and a lot of data. So being able to focus, refine the focus of what we're trying to do and what we're trying to measure. And that could be a number of different things. And there's also kind of two different levels of data. There's the community data, and then there's like all the different organizations in the community that are rolling up into that community-wide outcomes. And so there are ways to link and connect those dots, but just because we're doing it here doesn't necessarily mean you can draw a direct correlation to some of those community-wide outcomes. And so it's kind of the whole community and what they're doing to drive some of those things. So it really depends on what level of measurement you're trying to work towards. And behavioral health and whatever they fund can be part of whatever that larger initiative is.
If I might, just one last to build off of that. do you feel tracking like zip codes of where we're serving to make sure that we're reaching as much of the county as possible is something that we should continue to look at, to make sure that, we're reaching out to our rural areas as well, and some of these programs, I mean, because I know maybe there's some programs that say they serve the whole county, but if they don't have the zip codes or serving those folks, they might say they can do that, but maybe they're only focusing on some of their clients they serve really concentrated in one area. But maybe if we ask them to show some variety of zip codes, maybe there would be an incentive to, if they say they serve the whole county, really actually serving the whole county. I'm just wondering about that as well.
Yeah, my experience of reviewing a lot of, working with a lot of different organizations in the community at various levels, our grant program tends to fund a lot of smaller organizations, like under $1 million, and so in revenue. And so a lot of them, some of them may or may not have the capacity to do that, and some organizations, or depending on their program, might not collect that information if they're just doing training for events. They might not be collecting that if they're reaching 10,000 people. So it's really kind of program dependent, organization dependent on what they're collecting, because we've noticed that over the years of collecting data is everybody kind of does it in their own way. There's not like a standardized way across the county that everybody's measuring the same thing. So it's really hard to compare apples to apples. And so I know that that would be a challenge for some organizations, but some organizations, yeah, that's easy. They do it anyway because that's what they're doing and that's how they're tracking information. But some organizations say, hey, we're anonymous and we don't collect that information. People are free to show up to these group therapy sessions and you don't have to share any of your personal information. You're just here to get help. And so those are the ones where, you know, they're not tracking it for intentionally, just to remove that barrier for people to share their information.
Thank you. I appreciate all that information.
Thank you. Commissioner Stevens, do you have any questions or comments?
No, I'm good, thank you.
I have just a couple of questions. Well, certainly, thank you for all the good work, Laura, Jessica, and others. One question I have is, and I think it's building on something that the Commissioner Shedak McNally said, are we able to show correlation between how we're investing these dollars and, for example, a somewhat dramatic decline in suicides in Larimer County? Is that an example of a metric, or is that something that we can attempt to see if there's any correlation?
I would say that my gut tells me yes, and my gut is not very scientific. So, in response to that question, I think that as we have more and more attention paid to outcomes and not just outputs, which is the trend across almost every funder that I'm aware of in this community, I'm hoping that we collectively can start bringing some of those resources together. A great example is the successful launch of the Health Resiliency and Wellbeing Dashboard here at the county. So some of that infrastructure is already in process or has been created. And what I'm hopeful for is that, as the Commissioner Shattuck McNally just mentioned too, there's relatedness to another funding source, which is the opioid abatement money that is being distributed in our county by that independent council for these similar purposes. And I think we're going to find more and more opportunities becoming obvious to leverage the really smart people like Dr. Olson from our public health department, who can help us find the way to make those correlations. We'll never be able to probably have it be causal connections, but I think the correlation, we're getting closer as a whole community, and certainly these dollars would be one of the highest priorities I would have to integrate that into a system if we can start doing a better job of that as funders.
Yeah, thank you. So my suggestion would be, as much as we can be intentional about engaging people like our county epidemiologist and figuring out if there is a way to make those correlations. I mean, there's a lot of data real-time data we're getting from UC, Poudre Valley Hospital, UC Health, and, somehow there's got to be a way to show that we've prevented suicide, people who have suicide ideations, and that we're actually contributing to this rather dramatic drop. So I hope we can pursue that a little, as you all see fit.
It remains a priority for me anyway, for
Okay,
sure.
very good. Then I believe I have just two more questions. May have forgotten them. Yes, I have them. The second question is, I seem to recall in past conversations when we've talked about potentially increasing the dollar amount of the impact fund grant dollar program. I believe Laura and others have said we want to kind of keep it where it's at, maybe see what's happening this year, and that might help inform whether we should increase it perhaps in 2025. Can either of you speak to that, please?
Yeah, so my recommendation has continued to be, we recently opened the acute care facility at Longview with our partners, Summit Stone Health Partners as the operators. That just happened 4 months ago. And there is significant investment intended from the sales tax revenue to make sure that that operation is functional, it gets off the ground solidly, but we are learning a lot as we go about how much revenue is going to offset the investment that we had to make up front before they were even seeing their first patient, because they had to increase their staff, they had to get some new systems, they had to purchase different equipment to outfit the facility before they could even open it for the first day. And so that's been part of my conservative approach to not expanding the funding in other areas from this sales tax revenue until we have a very clear picture of what to expect in the support of the Longview campus and the acute care facility.
Totally, and thank you for reminding us of that. I think you've made that point before, and I think it's wise to see the facility having 1 year of operation, making sure we can pay the bills with the sales tax revenue, and then that would help inform whether we can put more money out in the community, perhaps. That's very helpful. My last question is regarding outreach. What are the next steps beyond April to get the word out? I know applications will become available. And have we, related to that, I guess this is a three-part question. What are the next steps with community outreach? What role do the commissioners have in supporting you and helping you in that? I have one suggestion. And thirdly, three-part question, one question, but three parts, which is really three questions. And that is, based on our past experience with outreach, have we learned anything different, that we might do some different approaches, especially trying to reach folks like in rural areas, like up at Red Feather or other places, or in the south part of the county? Good luck, Jessica.
Okay, I will try to address all parts of the questions. For outreach, after the recommendations are approved at Administrative Matters next week, hopefully, we do email communications, and so we will send out an email to our big listserv of folks, letting them know that the Impact Fund is going to be opening in June. We do host an Impact Fund webinar, like Impact Fund 101, in the middle of May, and so I host that webinar. And then we host another applicant workshop the first week of June, once the grant application is open. So materials become available usually the beginning of May. This year, because not a lot is changing, we can probably get the word out a little bit sooner. I've talked with our communication specialist about getting that out maybe 2 weeks earlier in April, so that folks just have more time. They have access to the resources a month and a half before we even need them submitted. And so that is part of the outreach. I also will be hosting virtual office hours for people to inquire or get questions answered. We have, in terms of outreach, we brought this with us today. This is some of our pamphlet outreach material that we've used in the past, so you can take that with you to any of your community conversations. I think there was some conversation in the past about us joining you on any community conversations, so we're open to doing that. We don't need to do a whole lot of outreach, I think, at this point, since we are getting $7.5 million in requests for the $2.8 million that we had available last year. So we're getting a higher number of applications and a higher dollar requests that we can actually fund. And so the word is getting out in the community about our funds, and so we are seeing a huge demand for those funding dollars. Does that answer all your questions?
Thank you. That's helpful. I guess I would offer a suggestion, maybe to change things up, recognizing that we typically get more requests than we have money. So you mentioned the behavioral health outreach list. I would suggest, if it's not already happening, which presumably it is, that there be collaboration with our public affairs office. And in particular, now we have a new community engagement coordinator who's doing great work. And for example, when you mentioned our community conversations, we all have outreach lists that go to, folks in Estes, et cetera. And after thinking through this a little bit, I would suggest that it might be helpful to coordinate with Michelle's office and then social media that we could put on our pages. I mean, those kinds of things. Thoughts?
Yeah, I believe Jennifer Wolf-Kimball, who's our communications specialist, is usually works with the Public Affairs Office to get those things out through those channels as well. There's usually a press
Qualified
release.
that with the word usually. What does that mean, usually? Will they be able to work with the Public Affairs Office?
Yes,
In 2024?
yes. They have in the past worked with the Public Affairs
Perhaps
Office.
consider the suggestion, if it's a good one, I don't know, it might be unintended. And whatever you come up with, to share it with other outreach lists that we have.
Absolutely. And I know that the capacity has really been added to, especially in the last year to 2 years, of the number of staff that really have a primary responsibility for community engagement. And so Jennifer is connected to that network of all of the communications professionals across the county, and I will make sure that she is informing her peers and connecting on what are the other outlets that we could be putting this through, including any other lists that might be unique and are different from the behavioral health, really the advocacy list that we have. It's not just grantees and professionals. It's hundreds of emails of people that have an advocacy lens towards behavioral health and want to be supportive.
And in the end, if we get more requests above the 7.5 million, that'll tell us something that we need to consider. It'll be more work for the folks who review all of this, but I think that's just something that's important. Commissioner Shaddock McNally, thanks for being patient.
Thanks, Mr. Chair. In the years past, I know that we have already done this and that they have coordinated with Michelle Bird in her office and have that out as through the commission, through the county government, and it's out on social media. And I know the list grows that you all have because there's lots of new folks coming in on into the landscape here in Larimer County. And I think there was just one in the newspaper the other day that's moving down from Wyoming. So I'm assuming they'll get on the list too. But the list is already really long. And when you talk about the folks that are reviewing this, I think it's great that we're expanding the outreach, but also a lot of these are volunteers who help read these packets and also staff. And it takes about 45 minutes per application for each volunteer to read through, and there's 80 people that end up reading all of these, and I want to be also mindful that, if we go from, 87, what was the applications, 59 last year or something?
We went from average about 55 to about 77.
Yeah, that's what I thought,
78,
77. So then, it just, and a lot of them were so closely related, it got down to being very minute details. So I just want to also be mindful of our volunteers who are spending like 45 minutes per application reading. And if they have to read a dozen more, that's another 12 hours of work. And so I just want to be thoughtful of that as well.
As we should be thoughtful, and I would say on the good news side of things, we have a track record of working with our Public Affairs Office, so that is good. Regardless of the capacity, I still think something new would be to reach out to other outreach lists, and I would suspect we're not going to get a tsunami of responses because those are mostly regular folks. And in the spirit of transparency and in the spirit of what we're doing, I think there's value there, but we should be thoughtful and we should consider capacity issues and unintendeds. Thank you. Anything else? Perhaps Commissioner Stevens, then of course, Lori, if you have anything.
Sure. Thank you for the presentation. You know, I'm very supportive of the work that you're doing. It seems like this is a good way forward. The only thing about adding to the people who know about the grants is, potentially filling any gaps that you feel like you're seeing as we look at health equity and stuff. So are you seeing, do you feel like there are vulnerable communities that, are they represented within the grants that we give out? Or you feel like, and I think that the Consumer Advisory Committee probably advises a lot around that, but,
They do, and that is one of the questions that's in the application is specifically around health equity. It's always been part of the application. It's actually always been part of the scoring rubric as well to prioritize those, and that can be defined in a lot of ways by a lot of different organizations for a lot of the populations that they serve. And so when the grant reviewers are reviewing applications, health equity is a piece of that scoring rubric, and then the executive panel when they're putting together the portfolio, make sure that there's the portfolio itself of that 2.8 million is making sure that it's addressing a lot of those through multiple different grants and different applications. So that's always been part of the process.
thank you. Well, I'm good. Thank you.
Thank you, Commissioner. Lori, is there anything else you'd like to add? Any insights or questions?
The one question that I had is related to the earlier conversation about trying to capture the demographics for the region by zip code. And I assume that with Longview opening, that we're going to have better demographic data, at least from that facility, because obviously we want to be able to show our partner agencies that we're serving a broader area. I remember that being such a point of discussion in terms of the location of the facility. And so maybe Laura or Jessica, you could provide a little bit more information on that.
Certainly. So I actually attended the inaugural meeting of the Longview Acute Care Facility Quality Committee yesterday. And that is an oversight group that was very intentionally created to track activity, outcomes, anecdotal success stories, a wide variety of data points that we can then tell the story of the impact of that facility. And very preliminary data that I was seeing drafts of yesterday included all of what you just suggested and more. There were lots of other data points such as, the referral source, the nature of the primary diagnosis that was provided, obviously location, where people considered themselves a resident. Interestingly enough, there were a couple of people from out of state, not Wyoming, that identified their residence spot to be Pennsylvania, and they were at the front door. So yes, gender identity, requesting that information, that's being done. Payer sources, there was a lot of data shown to us yesterday. So I think it's going to be a matter of taking that large menu of choices and creating something, kind of to Commissioner Kafalis's point, that really makes good sense to try to do some correlation. Because we could report on everything, but that doesn't really tell the story.
Well, thank you for that, and thank you, Jessica, for your good work in this area. I think it's remarkable that in such a short time, all the policy groups are aligned in terms of the targeted areas. They're reviewing similar data from all spectrums for lived experience to elected officials, and I think that's a tribute to the good work that you've done.
And
Thank you very
I
much.
concur. Thank you all very much for your presentation and for answering our questions and our suggestions. And
I just want to make sure I was clear that I support the recommendations in case I wasn't very clear on that, to make sure they had direction, but I thought it was clear, but I just wanted to make sure that.
which recommendation is that, Commissioner?
To go forward with, to put this on consent and to support these suggested recommendations for priority fundings for the
Thank you.
behavioral health grants.
Yes, I think that is the direction we are providing consent.
That was the only follow-up question I had, sir. Thank you for covering that as far as
So-
whether it should be consent agenda or discussion item. We just wanted to be clear. Okay.
And actually, as we've discussed in other matters, with your support, that we can maybe highlight it. We don't need to pull it off consent, but we could highlight the importance of this particular item, which we do.
Absolutely, and we'll have staff in the audience in case there's a desire at some point to pull that from the consent agenda and have discussion. We'll make sure that there's the right staff are there to talk about that.
Okay, I think at 3:06 PM, we're adjourned.